Policymakers in North Carolina have focused a lot of attention on health care access. A new bill in the General Assembly aims to help meet that goal, and joining us to discuss it is Brian Balfour, Senior Vice President of Research at the John Locke Foundation. Brian, tell me about the SAVE Act.
Yeah, thanks, Mitch. Well, basically what the Act does, it helps free up licensed nurse practitioners here in North Carolina, allows them a greater scope of practice to begin performing duties that are typically or currently reserved for physicians. So how that increases access, of course, is that for those patients who are in need of a lot of these services that otherwise would have been reserved for just physicians, it enables more people to provide those services. So it makes it easier for patients to access these kind of needed procedures and tests and so forth.
And we're talking about advanced practice nurse practitioners. These are nurses who have the training for the types of things that they would now be allowed to do. It's not just let's have the nurse do what a doctor should do. These are particular nurses with an advanced degree of training.
Right, exactly. It's very specific to these licensed and professional nurses. As you said, have a lot of professional training. They're very capable of handling these sorts of duties and procedures. It's just a matter of getting rid of these North Carolina regulations and restrictions that prevent them from doing so.
Right now, these advanced practice nurse practitioners, sometimes called APRNs, they have to work with a doctor. They can't just operate on their own. But it sounds as if the arrangement is the doctor has to fill out a bunch of paperwork, and the advanced practice nurse practitioner has to wait for the doctor to get approval. But the doctor isn't really there doing anything that the nurse isn't doing.
Right, yeah, these collaborative agreements, there's very little oversight involved, but it does present these hurdles, as you were talking about. It creates some uncertainties by these nurses. You know, what if they collaborate with a physician who ends up leaving the state? Then what are they left to do? It also imposes some additional costs on these nurses to enter into these agreements. So, you know, this SAVE Act will eliminate a lot of these hurdles, just make it a lot more easier for these nurses to do what they do best, and that's to help out patients.
This sounds as if it's something that could be especially useful in areas that have a dearth of physicians, a way to make more healthcare access easier in parts of the state where they do have a shortage of doctors.
Right, yeah, in particular in rural areas where there's physician shortages, very acute, and I think a majority of North Carolina counties, obviously in the rural areas, a lot of research has shown that there's a pretty significant shortage of physicians relative to the number of people that need to get some care. So this would be particularly helpful for those areas to ensure that patients that need some of this help can still get treated and tests and seen by a medical professional like these nurses that we've been talking about.
You recently blogged about this, and at the end of your blog entry says the SAVE Act is hopefully the first of many healthcare reforms that unravel costly restrictions that limit access to care. And you point to another one just beyond the SAVE Act, and that is something similar in terms of reducing restrictions. That is getting rid of the Certificate of Need law.
Right, yeah. Certificate of Need laws, of course, are those these requirements that medical facilities get permission from the state to expand or buy new certain equipment and so forth. So that's just yet another restriction that the state puts on healthcare providers. And so the SAVE Act here, eliminating and peeling back Certificate of Need laws, you know, it's all part of a package and a process that the state needs to undergo to really free up healthcare providers and consumers as well from a lot of these regulations that help drive up costs and restrict access.
Before we wrap it up, I imagine that one response that would be critical of the SAVE Act would be, aren't we endangering patients in some way? Doctors are the ones who have the most level of training. They're the ones who know best what to do with these patients. Why do we want to allow some nurses, even if they do have these advanced degrees, to take over some of these duties? Is there any evidence that this would lead to health problems or consequences that are not spelled out in the Act?
I don't think there is any evidence that would indicate that. There's been a number of other states, I believe more than 20 other states that have similar laws like the SAVE Act that we're trying to implement in North Carolina. And the result, there hasn't been any detectable, negative results or putting patients in danger. And indeed, the research has shown really a proliferation of even more of these nurses, which of course is then going to translate into increased access for more and more patients. So that's really the bottom line is just we're trying to get greater access for patients that need it in North Carolina, so they can access a healthcare professional when they need to.
And that also lowers costs.
Absolutely right, of course. When you transition more of these procedures into the hands of these licensed nurses rather than just the licensed physician, that those reimbursement rates are going to start to come down. So that starts to lower the costs. And of course, more competition, the more of these providers that there are out there introduces a little bit more competition along with that choice as well. That can also help to drive down costs.
The legislation is Senate Bill 249 and its identical companion in the House, House Bill 277. It's called the SAVE Act, and that's because it's an act to deliver safe, accessible, value-directed, and excellent health care throughout North Carolina. Brian Balfour is Senior Vice President of Research at the John Locke Foundation. Thank you, Brian.
Yeah, thank you, Mitch.